Recording. Good evening. This is the meeting of the Dundee Township 708 Mental Health Board of Trustees. This meeting will be held via telephone conference call in accordance with the Illinois Governor's executive orders and disaster declarations regarding the COVID-19 pandemic. To participate in this meeting as a matter of the general public, you were to contact Dundee Township Supervisor Trish Glees. Everyone, good evening. Governor Pritzker signed Senate Bill 2135 into law, which addresses electronic meetings during time periods when the governor has issued a disaster declaration, like the situation we are in now. Pursuant to this law, this 708 Mental Health Board meeting will be conducted by audio and video conference without physically present quorum of the Township 708 Mental Health Board because of the disasters declaration related to COVID-19's public health concerns affecting the township. Pursuant to this law, I, Dundee Township Supervisor, have determined that an in-person meeting at the township building with all participants is not practical or prudent because of this disaster. Okay. No one is physically present at the township building since it is unfeasible due to this disaster. This meeting will also be available via audio and video recording and made available to the public as provided by law, and all votes will be made by roll call. Alec, that's you.
Oh, okay. Well, we have Supervisor Trish Glees.
Nope, you got to start with, you have to start with it. Okay.
Yes. Trustee Dawn Arimura.
Present.
I'm sorry if I mispronounced your last name.
No worries. Arimura is fine.
Well, if I could know your actual
Sure.
pronunciation, if just
the
out
letter
of
R, the letter E, Arimura.
Arimura. Okay. Sorry.
Thank you.
Did not want to be insensitive. Trustee Maria Borrero.
Here, present.
Okay. Supervisor Trish Glees.
Present.
Trustee Alec Neuschaefer. Here. Present. Trustee Cindy Owen. I mean Oldin. My apologies. I need to put on my glasses. Trustee Paul Setze.
Here.
Trustee Reverend Wendy Witt.
Wendy, we can't hear you.
Sorry. Present. I muted it. My dog was barking.
Very understandable. And as the roll call is over, let us approve or amend the agenda as presented. I believe you...
Open the floor to discussion.
Yes, okay.
We need a first and a second. I move to approve the agenda as presented.
Second.
You have a first and a second. Dawn was first. I was first. Dawn was second. Ask if there's any discussion.
Is there anything to discuss? I have a few things personally.
For the agenda?
Oh.
This is
for
only
the agenda now.
This is only to approve the agenda, okay?
Okay. Well then.
All right. Maria, would you please do a voice vote? Call each of our names and we'll approve or not approve the agenda.
Okay. Trustee Dawn Arimura.
Approve.
Trustee Maria Borrero, I approve. Supervisor Trish Glees.
Approve.
Trustee Alec Neuschaefer.
Approve.
Trustee Cindy Oldin.
Approve.
Trustee Paul Setze,
Setze. Approve.
Trustee Reverend Wendy Witt,
Approve. Can I ask just to have the Reverend dropped? I don't want to be the only one who has a title in there, and
Yes,
I would
ma'am.
just prefer to be just Wendy Witt. That's okay.
Yes, you may. That is your discretion. We will clear that up.
Thank you.
Okay, Alec, seeing that there are 7 ayes, the agenda has
Yes.
been approved.
Indeed.
No, I need you to say that.
Oh, okay. Well, seeing as though there are 7 ayes, the agenda has therefore been approved. And hereby motion to dispense with the reading of the minutes for July 9th, 2020, the 708 Mental Health Board regular meeting.
So who's first?
Okay.
We need a motion.
I would,
Setze moves.
trust.
Ask for a second, Alex.
Oh, could I ask for a second?
I second.
Okay.
One of us does.
What about you, Trustee Dawn Arimura?
So move.
Okay. Trustee Maria Borrero?
No, Alec.
I'm sorry.
The secretary has to take a roll call. Go ahead,
Oh, I am
Maria.
very sorry.
Well, ask if there's any discussion.
Is there any discussion about considering? No.
so this
Now,
is for the approval, correct?
Right. Yes, go ahead.
Trustee Dawn Arimura,
Approve.
Trustee Maria Borrero, approve. Supervisor Trish Glees,
Approved.
Trustee Alec Neuschaefer,
Approve.
Trustee Cindy Oldin,
Approve.
Trustee Paul Setze,
Approved.
Trustee Wendy Witt,
Approve.
Alec, seeing that there are 7 ayes,
Yes.
the motion is carried.
Yes.
No, I need you to say
Oh,
that.
seeing as though there are 7 ayes, the motion is carried.
You're doing good.
Sorry. Anyway, we have now moved on to public comments, I believe, and I would like to,
You're not the public.
yeah, just move past that, I suppose, since there.
Nope, you got it. You have to ask, is there anybody in the public?
Is there
room?
anybody in the public? That is what I was trying to.
President Neuschaefer, as the host of the meeting, there is nobody in the public. So and I have no written public comments.
Okay. Well, then we move to new business. The nomination of Paul and as the 708 Mental Health Board president.
I motion.
Yeah.
I motion.
Second.
Who is the second, Maria?
Yeah.
Okay. Ask for discussion?
Well, I personally,
No,
Oh.
Alex, you have to ask for discussion.
Is there any discussion?
is there any discussion over whether or not Paul should be president or his qualifications?
Okay, go ahead. Now you can say anything you want,
Well,
Alex.
Alec, I'm sorry.
Alec, yeah.
Well, I would personally have to say that after speaking to him, I am very confident in his abilities. He is an incredibly diligent man. He has a very, very complex brain, and I can tell that after just talking with him one-on-one. I personally want to learn everything I can from this man. He is very compassionate, very tenacious and persistent, I would say, and I have gained this merely after, you know, a nice talk. So I would most certainly nominate and push him to be president.
Ask, is there any other discussion?
Any other discussion as to this subject of nomination and Paul, basically?
Okay, seeing no more discussion, ask for a roll call.
Roll call. I would like
No,
to.
you got to say those. You have to say
You
those
have to
words.
say, I would like to ask for a roll call.
Okay. So we are approving, correct?
Yeah, this is
do I
the
have-
non.
Do I have to say that this is to approve the nomination of Paul Setze as a new president for the 708 Mental Health?
Yes, ma'am.
Trustee Don Arimura,
Approve.
Trustee Maria Borrero, approve. Supervisor Trish Glees,
Approved.
Trustee Alec Neuschaefer,
Approve.
Trustee Cindy Oldin,
Approved.
Trustee Paul Setze,
I'll abstain.
Trustee Wendy Witt.
Approve.
Okay, we have 6 approve and 1 abstain.
As Dundee Township Supervisor, with the 6 ayes, I want to take the minute to thank Alec for stepping up and trying. He is going to learn a lot and hand the mantle over to Mr. Setze. Take it away, sir.
Thank you, Trish. Thank you for those kind words, Alec, and thank you for everything you've done up to this point, and I'm sure your contributions moving forward will be well appreciated and will also make a difference. Moving on with the agenda, there are a couple just items that I think we can get through fairly quickly here. Item B is identify deadline for determining the tax levy, and this is really asking Trish to let us know the precise date that she needs our decision on the tax levy so we can schedule it at the appropriate time. So Trish, do you have that timeline for us?
I do. So the tax levy must be approved by December 31st. The board meets on December 16th. That's the Dundee Township Board. We'll meet on the 16th. I would like to have the levy approved by the 10th of December so that the Dundee Township Board does not approve or disapprove of this. I just would like that in their board packet so that they see it. And to do that, I need to have it by the 11th of December.
Okay, so that, based on that and based on the fact that we'll have a meeting in November, I think we should schedule that vote for the November meeting. Unless people see otherwise, are there any other comments on that from board members?
I have a comment.
So
I
go
would
ahead,
like,
Maria.
yes, I would like to know information. This is the first time I see like tax levy. I don't know what that means. Like, can somebody explain a little bit more of what that would, how that would impact the, our program?
Paul, can I explain it?
Sure, go ahead, Trish.
Or do you want to take it? You take it.
I can take a stab and then you can correct me. How's
Okay.
that?
That's right.
So in April, the voters of the township to approve a levy of 0.15% tax on property to be added to your property assessment. That is the maximum allowable assessment under law. The choice we will face towards the end of the year here is whether we keep it at 0.15% for the subsequent year or whether we decrease it. That's what we do moving forward. Probably some of that decision will be based on what we intend to do over the next couple of years. So my thinking on this was to give us enough time to at least have enough discussions and collect enough information from the township residents to at least make a sound decision around that come November.
Okay.
Did I get it right, Trish?
Only, I have one correction, and it was March 17th.
I'm sorry, the March primary. Thank you.
But yeah. So what, the issue, I just like to always clarify because percentages is always a very confusing thing. What, right now, if we ask for the total 1.5%, the 708 board will be a recipient in June of $2.4 million. So that's a little bit easier to, well, they'll get half of the 2.4, they get the other half in September. And the only other thing is the 708 levy is a lockbox. What that means is that can only be used, or the money can only be used for things that are approved by the 7 of us on this board. No other things. And when I say the 7 of us, it's always the majority. You know, it's a majority rule.
So that will be the vote that will take place tentatively in November, where we are going to decide
how much money we want, or
Okay.
how much money we need. The word want is I know always what we'll need.
Okay, got it. Thank you so much.
Right, and that money would be for the fiscal year beginning when?
It'll be, that's the funny thing. The fiscal year starts March 1st of 2021 through February.
28.
28.
Yeah, I had to think if there was 28 or 29 days, sorry. February 29th of 2022.
Okay.
So just to give you an idea, we really, we're going to be planning programs to start March 1. And really, we're not going to have the money till June 1, but there's a float in there. Just, you know, so I don't want anybody to panic that, oh my, we're starting a program, but we're not going to, there's an understanding there, okay?
Are there any other comments, questions from the board?
Relating to the tax levy or just,
Yep,
this-
we're only on the tax.
oh,
For this
well,
item?
I personally think we should, obviously see how things go, and that's about it. I have people who have given plenty of feedback on the tax levy, but I'm not sure if that is relevant, since I don't necessarily agree with nor believe these people have an understanding as to what and how the tax levy works. So that's about it. I don't know.
Okay, thanks, Alec. Anyone else?
Yes, point of correction, it's February 28th, 2021.
No, well, February, what's 2022, Don?
2022.
Oh, 2022.
Yeah,
Still February 28th, 2020.
still, all right, that's thank you for the point of correction.
Those dang leap years.
I know.
I do. Oh, actually, if I can interject over the tax levy,
Sure, go ahead.
or unless we have moved on. I have heard from a lot of people that there isn't much we can really do with 2.4 million in just say a year when it comes to mental health, and we're rather cynical about it. I myself not as cynical. I think we should save every cent we have and, you know, do what is necessary.
Alec, if you would like, you and I can have an offline discussion
Oh, I am sorry.
on this. No, I just so that I can put, you can help put people's mind at ease. We can have an offline discussion on how the levy works.
Okay, my bad.
Okay? No, that's okay.
Okay, if there are no more questions or comments on the levy, I will ensure that you have enough time for a discussion and a vote on in the November meeting, which will determine the date for a little bit later on during this meeting. So I'd like to move on to new business, point C. I put this in here just to make everybody aware in case they missed it when they read the legislation. But we are responsible for creating a 1-year and a 3-year plan that we need to deliver to Supervisor Glees as well as the Dundee Township Board of Trustees. And it's section 3E, subparagraph F of the legislation, if you haven't had a chance to read that. It's pretty broad in its description of what the plan is. But we'll talk about that some more a little further on down the road as we gather more data and get a little better organized here. But I did want it to bring it to the attention of the board early on, so that we have it in the back of our minds and it doesn't get we don't get surprised by the fact that we have to do this. So this is, from my perspective, an information item, but I certainly open it up for questions or comments from any members of the board.
Question and comment.
Go ahead, Maria.
So this will be delivered via Zoom meeting as well, I'm guessing, these 1- and 3-year plans. And do we have a tentative date on when are we going to present these plans?
I would assume that we will be doing this through Zoom meetings in the SharePoint site that Trish set up for us, which we'll talk about a little bit later on. Because I don't, to be honest, my personal view is I don't see how we can have a person-to-person meeting before the end of the year, given how the virus is going right now. So it'll be a bit of a challenge for us to put it together. There is no deadline in the legislation. But I think if we're working diligently towards that, you know, over the next 6-7 months or so, and as Trish mentioned earlier, you know, we can have programs going as early as March 1st. So, you know, that also involves prioritization on our part as well, going forward.
Thank you so
So
much.
no way of, I mean, I have no path plotted out right now on how to get there, but I just wanted to bring it forward to everybody, and we'll work on it together to figure out how to approach this for sure.
Okay, thank you.
Any other comments or questions on this?
The only comment that I have is that we can bring in what I'm going to refer to as guest speakers. We can bring in other township supervisors, such as the supervisor of Bloomingdale, the supervisor of St. Charles, the supervisor of Aurora. Bloomingdale is kind of our closest, not necessarily demographics, but dollar-wise, they're our closest township, even though they're not in Kane County. But we could bring them in to to give us an overview on how they've done their boards, how they've done their 1-year plan or their 1 and 3 year plan. So the nice thing is we don't have to forage through the forest ourselves. We can bring along guides if need be.
Well, that's good to know, Trish. It would also probably be helpful for the board if we had copies of plans from representative townships as well.
I can go, oh, well, Dawn already has one set of them. Dawn, is that Bloomingdale's?
Yes.
Could you please put that on the SharePoint or share that with us? And then that's one less, then I don't have to call Michael.
I do have it, and I have both the 1 and the 3 year plan. And Michael is very enthusiastic and supportive of what you're doing.
Yeah. I know Michael very well, so yeah. So would you mind sharing that? Then I won't bother him. Okay. I know he and I are both doing other things. Okay.
Okay, thanks, Don, for that. Okay, if there isn't any more discussion or questions around point C here under new business, we'll move on to point D, which is more of a housekeeping item, to set the meeting dates for the remainder of 2020, so we don't have, so we can all plan our schedules, essentially. What I would like to propose is that we meet on the second Thursday of every month, which is what today is. And if we did that, I've got the dates here, which would be September 10th, October 8th, November 12th, and December 10th.
I would, if we could go, I would like to go out for the year and then in December do all of 2022, only because it does require, I am required by state law to publish our agenda 48 hours before a meeting publicly, and that gets published on our website. So if that would be helpful for me, Paul. I don't know if that works for everybody else. And then if we could just pick a defined time.
Yeah, I was going to get to the time after
Okay.
we decided on the meetings.
Okay, that's fine.
We'll keep those two issues separate. How's that?
That's fine with me.
Okay. Any questions or comments on the meeting dates? I mean, are you good, Trish, are you good through going through the end of this year? And then later on, we can work on the rest of the dates?
Yeah, if we can start the rest of the dates, like at our December meeting for 2022,
Sure.
I'll be fine with that.
Okay.
That's fine.
I personally like the idea. I mean, it works for me quite well. But I don't know how well it works for others.
Trish, is this something we need to vote on?
If we could do a roll call just from a procedural standpoint, but let's get the time in there too, so we're only doing one roll call.
Okay. So last meeting, we decided by roll call vote to have the meeting start at 6:30.
And that was my fault that I set it up for 6.
Yeah, and I didn't see that until after I read the minutes, so. So I guess, can I have a motion to set the meeting dates for the remainder of 2020 for, the dates would be September 10th, October 8th, November 12th, and December 10th for the meetings to start at 6:30 p.m. on those dates. Can I have a motion?
I move that we accept the dates as put forth by Trustee Setze and the time. I move that we accept the time of 6:30 and the dates.
Can I have a second, please?
I second. Oh,
Alec, go ahead. You got it.
I just I guess we beat each other. I beat, but yeah, I second that.
Okay, we have a first from Trustee Arimura and a second from Alex, Trustee Neuschaefer. Is there any discussion?
I have no discussion. Cindy, will that work with your work schedule? Okay. Wendy, will that work with you?
Yep, that's what I'm checking right now. It's perfect.
Okay.
Any other discussion?
I will publicly apologize for screwing up the time.
You're forgiven,
Thank you.
Trish. Can I have a roll call, please, Maria?
Yes. So we are approving the meeting dates for the remainder of 2020 and the set time to be at 6:30 p.m. Oh man, I have to go back. Okay. Trustee Arimura,
Approve.
Trustee Maria Borrero, approve. Supervisor Trish Glees,
Aye.
Trustee Alec Neuschaefer,
Approve.
Trustee Cindy Oldin,
Approve.
Trustee Paul Setze,
Approve?
Trustee Wendy Witt.
Approve.
We have 7 ayes, 0 nays.
Okay, the motion carries. Those dates for the next 4 meetings are set, and we will start the meetings at 6:30. Thank you, everybody. So the next item on the agenda is just open discussion. If anybody has any other items that they want to bring forward that aren't on the agenda, now would be the time to bring them forward.
Well, if it's fine with everybody, I would like to give everybody kind of an update as to what I've been doing. I've told Paul and Trish about the interviews that I've been.
Alec,
Oh,
can I stop you for a second? We have that as a separate item under old business.
oh, okay.
So if you can just hold that. We'll cover that during old business. How's that?
Oh, that's completely fine.
Okay. Are there any other items that aren't on the agenda that people that people would like to discuss at this point?
Trustee Paul?
Yes, Trish.
Wendy and I, Trustee Witt and I, yesterday had a good conversation. One of the things that I do want to bring to everybody's purview is that the homeless population in the township is increasing. And for the first time, and Wendy said it succinctly, for the first time, the homeless people are noticeable. We can see them. They're not hidden in the shadows. If anybody if you run into anybody who is homeless, the township, besides the 708 board, it is my responsibility to help all indigent people. So please reach out to me. Wendy and I have a great preview of the park at Graffleman, where seems to be a little bit of a home headquarters. But if you see anybody else, I have water that has been provided, and I have MREs, which are meals ready to eat, that are provided by the state. So I've got them covered. If you would just, just if you see something, let me know. Just kind of give you that heads up.
Would you rather us I don't know, give them your email or?
No, you call me. Pick up the phone and call me, because
Okay.
In the moment I can be mobile. That's the good thing, because then I can arrive. And this way it is my responsibility, and from which you guys are all going to learn, from the protection of people's identities falls within my office. So you just reach out to me, and I can see, I can help right now without the 708 board. We have stuff. Okay.
Is this question, is this regardless of legal status or any like
I could care less. I don't
language
care.
barriers? Are there any like contacts for?
So the nice thing, Maria, is I do not speak Spanish, but I do have resources, and depending upon where they are, I sometimes come with the police. I'm not gonna tell you I don't, but I have availability to Spanish-speaking people that can translate for
Perfect.
me and translate my words.
Yes. Perfect. Thank you.
Any other questions or comments? Okay, thanks, Trish, for pointing that out, and Wendy as well. Interesting, when I was talking to police chiefs, homelessness came up as well. So we can talk about that a little more later.
Yeah, it came up with clergy.
Yeah.
Clergy too.
Sure. Okay. Then I think we'll move on to old business. And I have to admit, I'm a little confused here because I don't understand what item A is. Discussion of special interest group feedback. I think that's the same as the status of the interviews we were doing.
Yeah. Yeah.
Yeah, okay. All right. So why don't, if you don't mind, Trish, why don't we go to B first, and then we can talk about how our interviews went, if that's okay with everybody.
Yeah.
All right.
Okay. So first and foremost, did everybody get the link for the SharePoint connection?
Yes.
I did, but it did not work.
Okay. Secondly, does everybody have Office at least 2017 or Office 365?
No.
Yes.
Yes.
Have any idea?
Yes.
Okay, Maria, you don't have Office on your computer. Okay, we'll
I have
figure
a Mac.
No.
Oh, okay. What do you have on your Mac?
It's just their, like the word processor, PowerPoint, Excel, but it's not Microsoft.
It's the Apple version.
Yes, correct.
I'll work with you. Cindy, how about you?
Okay.
I do have Microsoft Office, yes.
Okay, so that's the good thing. So SharePoint, Alec, I'll work with
Okay.
each one of you individually, but the SharePoint site, and if I was not having major technical difficulties, I would share my screen so you could see it. But the SharePoint site is a repository where we can all put any kind of documents and stuff. The email address that I created for the 708 board is, I have to go to a different screen. Is 708board@dundeetownship.org. And right now, everybody has access to it by logging in. Yeah, I'm not going to tell everybody how to do this because I just realized this is a public
It's in
meeting.
public, yes.
Yeah.
But everybody can access the portal, and via the portal, there is Word and Excel should you need it. But so everything is set up. The emails that you got, and I know some of you got 2 or 3 of them, were me sending them directly from SharePoint to make sure you could access it. Alec, understanding you couldn't, we'll figure out what's wrong with your email address.
Oh yeah. The SharePoint, it was more of a problem with logging in and the
Okay.
password and things of that sort. But
Okay.
obviously, again, we can't
Yeah.
talk about that.
Yeah, so we can definitely discuss that. So what if anybody, now, Paul, if it's all right, can I take over, Paul, and share my desktop?
Sure, go ahead.
Okay, so hang on. Okay, if I do this right, you should be looking at the Dundee Township website.
Yep.
Yep.
Okay,
Yes.
you'll see right in here is the 708 Mental Health Board. Let's click on there. I'm still working on the page. Inside here is where I would put the email address, which is 708board@dundeetownship.org, so that people could contact us if they have any questions. But then also, as we provide public documentations, you name it, etc., that would go here in this blue box under members. Now, everybody did give me their, I'll move over to this. Everybody did give me their pictures. Dawn, I have yours. I just have not had a chance to pull it up. But if you look at this, if you give me, and Wendy, I'll take Reverend out of your title. You can read everybody's profile, if you will, or their bio. And so, and if you want to change it, we can make changes. But going back to this screen, this is where the public, along with any of the 9 village administrators, this is where they would routinely go for information from us. Okay, so not the internal stuff that we use on SharePoint, but public documents. Okay. All right. And as I said, if I could actually get SharePoint to work, I would show you how it's working, but I'm having problems with my system. So, okay. And I will do one-on-one classes via Zoom with anybody and everybody. You know, that's on the board.
Please.
Just call me and set up an appointment with me, or send me an email, okay?
Okay, thanks, Trish. Okay, what I'd like to do now is move on to have everybody talk about their experience in reaching out to members of the community and some of the things that they've uncovered that would be useful for future decision making. So I think what I'd like to do, if everybody is in agreement with it, is just go through the trustees alphabetically. And so, Dawn, I'd like to start off with you. Talk to, if you've had any, if you've reached out to members of the community and how those discussions went and what you can relate to us in terms of what you found.
Okay, I'll start out with Mr. Phil Brakefield. Mr. Brakefield is a resident of West Dundee. His daughter, Jamie Brakefield, overdosed and died in 2017. He wrote a book about his experience, and he is willing to donate copies of that book for education and giving out to the public or for fundraising. He is a marketing person and suggested that we do monthly or even more often press releases to educate the public about the 708 board vision, and he'll assist in that marketing. I also worked with Mr. Mike Murray, who is instrumental for passing several 708 board legislation around DuPage townships, DuPage County townships. We have 2 federally qualified clinics, which is going to be important for drug and health care. One is Aunt Martha's, the second one is Legacy Medical Clinic. I I also spoke to Mr. Chris Reed, who is the New Direction Addiction Recovery System, NDARS, in Crystal Lake. He established the Sober Bar in 2000 and helped fund and start up 3 sober living houses, 2 of them for males and 1 for female. He also is very instrumental in the purchase of the Pioneer House, which is something I am very interested in. It's a homeless shelter and it has 40 beds, and the McHenry 708 board helped purchase the property and turn it into and expand the homeless shelter. So it's a permanent homeless shelter. And it also has classes and support for the developmentally disabled. One of the people I'd like to come and speak to us is Mr. Chris Reed, and he's agreed to that. In Crystal Lake and in McHenry Township, every overdose is connected to services right away. So if a person has a drug overdose and they're revived with Narcan, they're immediately connected with a social worker and services. I like what Crystal Lake does because it's a public health model, and it's and they've done this in 10 years. So it's been a very fast-moving program. Their program was so successful, they are returning money to the taxpayers. They have saved, they spent money the first 5 to 7 years, and next year they'll be refunding some of the levy to the taxpayers of McHenry Township, which is stunning. But it took a leap of faith to do this funding for 7 or 8 years before they got to the point where they're returning money. Lisa DeVivo is the longtime executive director of the Oak Park Township 708 board. Ron Melka, who is at Lyons Township, has been involved. He's a professor. Brenda Huber did a public health model down in Livingston County, and she can also speak to the board. And I also took a look at the NTI Leadership Institute. So these are all ideas and templates that we can piggyback on. So we don't have to, there's a lot of expertise that we can pull in. And given that both Bloomingdale Township and Chris Reed and Professor Huber have had experience with starting programs from the ground up and have measurable outcomes, I suggest that I would like to invite Mr. Chris Reed, Mr. Phil Brakefield, Professor Brenda Huber from Rush, and possibly, oh God, I forgot his name. Mike Hovde, Supervisor Mike Hovde from Bloomingdale Township to speak to us. Oh God, that one's going in the public record. Wonderful. I've been very impressed with what Bloomingdale Township has done in 4 short years. It's really exciting, and I'm hoping we can do something very similar in a very short amount of time. And that is the end of my report. Thank you.
Thank you, Dawn. Any questions for Dawn? Comments?
I would like to comment. Well, Dawn, I think you just did absolutely impressive work, and I think these are all roads we should look down as models, personally. So
Thank
I
you.
think great work on you, and lots of initiative.
Okay, thanks for that, Alec. Anyone else?
No, Dawn, I think it's an excellent job, and the value add or what's going to be interesting is none of these services exist in the township today, which is going to give us the ability to mix, match, and choose the best services for us. So that's really an uplifting thing, Dawn, that you've got people, you know, already in line to come in and talk to us.
Thank you.
Okay. Moving on to Maria.
Guys, so I'm sorry, before we move on, I'm just going to summarize each of our like experiences, because I know you mentioned like a lot of names, but in my notes for like note-taking purposes, I'm just gonna like kind of summarize the most important like areas that you talked about. So is that okay? Like, I just don't feel like maybe putting names in our notes or like putting like a lot of information, or do I have to do that? I kept typing and I was just like, I don't know.
So Maria, the nice thing about this is a video, and the video is being recorded, and the video until some further date in the future will be available. So if somebody wanted to go back to specific names or why we picked A versus B versus C, they would be able to reference our videos. So you're okay with summarizing. They're not, your notes are not, minutes are not verbatim.
Okay, good. Because I thought everything was so great, and like the fact that I didn't even know there were like the sober houses, like sober living houses, you know, that's amazing. So I tried to like pick and point like what the most important parts. But yeah, now moving on to my experiences reaching out to educators, it was very interesting. I have to say that educators were very hesitant to share and to give their names. So I don't know if you guys saw in the SharePoint, I uploaded my notes. I uploaded by category, kind of like, I don't know if you guys saw, but I had all sorts of experiences. I had an educator with 28 plus years, but I also had a very early educator with like 3 years of experience as a social worker. So all of them didn't want me to share their names. So I thought that was very interesting, because I just feel like educators are very critical about, you know, not criticizing, but understanding that there is a lack of resources in mental health in our schools. And for example, one of them said that they worked in a school with over 700 students and they were the only social worker. So, you know, lack of like the overwhelming amount of cases that they will have to face on a daily basis, lack of resources when it comes to pairing students with outside counselors. So for example, counselors that are within the day, sometimes they have to share buildings. So there was a counselor that had to go to an elementary school and also to a middle school. So in those 4 hours that she wasn't there, all the students that had crisis, all the students that were going through mental and emotional crisis were not served. And she had to go again on the next day, and kind of like that would be added to her, you know, original caseload. So I thought that some of their quotes and some of their comments were very interesting. One of the other things is that most of the teaching staff referred a lot to issues like bullying and anxiety and depression. And the majority of the counseling and guidance staff referred more to community and outside resources. So if you look at the document, you will see that there's all sorts. I think I have 1, 2, 3, 4, 5 people that have replied so far. And I have all ages. I have a social worker, I have a Success Academy coach, which is an alternative school program. I have a psychology teacher, so their direct quotes are in there. I don't feel like I'm gonna like read them all, but I think it was really shocking to know that they just didn't want other people or like the community to know that it was them that were, you know, being critical about resources regarding mental and emotional health in the schools. So yeah, one thing that really stuck out was I'm just gonna read it. One of the people that I interviewed said is, I think the biggest factor that I have seen for mental and health concerns working with youth is social media. Bullying leading to depression and anxiety. Social media has played a huge factor in today's youth, and they value others' feedback on it. It has become detrimental because they can message negative things to each other easily with no remorse. This leads to depression and anxiety, as sometimes they do not tell anyone until it has gotten out of control, and they are losing sleep over it or continuously thinking about it all the time. Sometimes students have even expressed negative thoughts on themselves from going through online bullying. I do think more needs to be done about social media with our youth because it's out of control. I thought that was interesting, you know, compared to maybe in other ages, like, I don't know, in 10 years ago, we wouldn't think about that being such a huge issue, but this is a early career educator. She only has 3 years working as a social worker, and she can see that that has been one of the worst things, you know, affecting our youth right now. So I have more quotes in there in the document I uploaded. I don't know if you guys saw it on SharePoint, but it's in there. Yeah, that's basically it for me.
Okay, thanks, Maria. Are there any questions or comments from Maria?
My only comment is, as someone who has been focused on interviewing the youth, I concur heavily on, you know, a bunch of people around this age, you know, even past high school and all of those ages, still comment and say the same exact things you are relaying. So doesn't stop there, fortunately.
Okay, anyone else? Okay, Maria, thanks, and thanks for uploading them to your notes to SharePoint. I personally haven't had a chance to read them, but I'm sure I will, and I'm sure everyone else will take a chance to look those over. So thank you very much.
Yeah, your notes are very, very telling.
Yeah.
Okay, where are we here? Trish, I don't think we asked you to do anything, did we?
Well, wow, I
like
appreciate.
1,000 things at once.
You know, one of the things with my job is, you know, so I get to be the conduit of lost souls sometimes. So talking to many of our seniors, many of our homeless, many of our disenfranchised people, what keeps, and this is an interesting thing from a senior's perspective, and I'm sorry if I harp on this consistently, but it's the homelessness. And what I found interesting from the senior perspective is that they're upset that there's homeless people, but not because there's homeless people. They're upset because they grew up in a time or a generation where you opened up the door and so-and-so slept on your couch, or, you know, you in your garage or whatever. I mean, I heard stories of people telling me how they, you know, they had, you know, the grandma living in the attic or the uncle in the garage. So the lack of, right now, our ability to house or protect them is really key. You know, when I talk to them about the 708 board, I was really thinking they were going to talk to me about things they need. You know, they want a podiatrist. They want, you know, and I get that. The other thing that podiatrist is very big with seniors. But the other thing is they want to make sure that they continue to have a safe access to get around the town, safe transportation. You know, most of our seniors are riding cane users. You know, they want to make sure that's there for them. And, you know, so that's something to think about. You know, so it was surprising that homelessness did seem to be very much because, and I'm thinking that most of the seniors live in apartments within the township that are around open space locations. So around our open space, so they see people living in the woods, and so they're questioning why. So that's from my seniors. From my homeless people, you know, some of them are willing to get help. Some of them just want help to move on to the next place. They're transient. You know, but they also say they really don't have a place to take a shower, to safely go to the bathroom and not worry about their stuff being taken or stolen or messed with. So, you know, and some of it I'm sure is drug related, alcohol related, PSTD. So you know, I'm going to, I think, unfortunately, consistently dwell on our homelessness in the township.
I have a lot of middle-class families that, and working moms that are homeless.
See?
Currently, I have 3 families that are couch surfing, one in a basement, one in a garage, and one who fortunately it's a bigger home, so that they're all in one bedroom. But all of these people have full-time jobs.
Right.
Oh,
There is, so that's right, Dawn. So that's a whole nother category of homelessness. The couch surfers, the families that are renting rooms from other people. You know, and it keeps rounding and rounding in my head. Not the why. I think we can figure out the why, because homelessness isn't the disease. Homelessness is really a symptom. But what keeps going in my head is, how do we help them? How do we protect them? You know, I'm really going back to Dawn. I'm really interested in talking, you know, about the Pioneer House, the, you know, pads, you know, and Dawn is right. You know, for those parents who are working, they're bound. They're not going to be able to displace themselves or their families because the kids are in school. So for us to say, oh, well, there's a homeless shelter in McHenry, just go there, that's not the option. And I'm not pointing anybody towards, you know, a homeless shelter in Dundee Township. Over time, I will do that, but you know, but I think we have to think about what we're lacking, you know, and so I'm going to continue talking to my seniors. I will continue talking to the homeless. Of course, you know, the homeless, you know, they want medical. One thing that I've been carrying is I have a box of masks. So every homeless person that I see that doesn't have a mask, I offer them one. That way they are at least allowed to go into stores like Walmart if it's raining, or the library, should they want to. They at least have a mask to use. So
I think a big problem is that these people, there are a lot of people I know who aren't even aware that there is a predominant homeless problem in this area.
Mhm.
There are people who I know who are, let's just say economically a bit more on the wealthy side and just don't even know. And in the case of
Adding to your comment, Alec, it's so important to know that you do not know how a homeless person looks like.
Right.
Most of the time in our schools, we will find out there are our students were homeless through other students
Mhm.
or through the family literally just not having food. They did not have food. They will come in literally begging for us to give them food, because parents and families, especially like resilient families, would do whatever. They would just shower at the gym, or they would just look for whatever cost to make it so that their children do not look out of the ordinary, that they just look normal, that this is just temporary. So it's just so important that we keep an open mind when we say homeless. That means people that are going from house to house. That means people that don't have a bed. That means people that that are struggling. So I think it's really important to kind of the stereotypically homeless person, in the street. That's not the type of homeless we're talking about. We're talking about working class people with full-time jobs and all of that. So I think that's really important.
yes, I mean, that is just as important. All I'm saying is generally referring to the homeless and referring to the problem. I think a lot of people, regardless of whether they picture couch surfing or not, people are still just so ignorant of the problem.
Well, I think there are a couple of different ways to look at it, Alex. I think Maria's point is that a lot of the homeless in this area, in the township, are actually invisible to us.
Right.
Even those of us who are aware of it, unless you're like in a school system or you're in a position like Trish's or Wendy's or Dawn's in particular, you don't have day-to-day experiences with it, and a lot of it is invisible. And that's an education thing. But I think that's the point. I don't think people, although there's probably a small percentage of people who would like to remain ignorant of the issue, I think that a lot of people are open to it if they're informed that this is what's actually going on in the community. So I don't think I don't think on the part of most people it's a deliberate ignorance or a deliberate saying this is not a problem here. I'll talk a little bit more about this when I talk about my discussions with the police chiefs in the area. So I'd be a little bit hesitant on assigning motivation to people. And I think part of our role here is community education about what some of the significant issues that are facing the residents of the township really face, and homelessness is a big one, a lot bigger than most of us understand. Are there any other comments for Trish? Questions? Anything else at this point? Trish, thanks a lot for that. I think that was that's really helpful. It ties into a lot of things I'm going to talk about a little bit later on here.
I only hope I was being respectful.
You were, Alec. No,
okay.
Not a problem. I just thought I'd point out, I
didn't want to be disrespectful.
No, you weren't disrespectful at all. I was just trying to expand on some of the points that Maria was making.
Okay, thank you.
Okay. Okay, Alec, you're up next.
Oh.
Alec, before you begin,
yes.
I just want to caution. Trish had alluded to this a little bit earlier, but we need to be very careful about names.
Yes.
And I know you and I had talked about this earlier, but. Particularly in the discussions that you had with people, which were people some of whom have experience with mental illness and have interfaced with various services and things.
Oh, yeah.
We need to protect their identity. So that's all.
Mhm.
I just needed to say it out loud. I know that you were doing that,
Yeah,
but I just
omit
wanted to make that point.
any names.
Yeah. Okay.
Of
Go
course.
ahead.
Well, I've had some varying experience. I did try to approach this in a typical interview fashion. When it comes to people my age, they always seem to have this attitude as though, oh, I don't have anything to contribute when it comes to, my thoughts and da da da. But the people who say that the most, I have learned through my process, have tended to contribute the most without really noticing it. So I found that fascinating. I have tried the strategy of more or less interviewing people by just warming them up, offering them, some yerba mate or some tea, comforting them, actually maintaining an emotional connection, and kind of almost disarming their personalities and egos to an extent, and eventually, telling them like, okay, are you fine if I interview you? And then all of the opinions just kind of come out, I'd say. And I think that leads to an overall productive situation. When it comes to who I have interviewed, the range has been from, I believe, 24 to 18. So there's one thing that I found a bit to stand out a bit more than the others was an 18-year-old who I reached out to. And this was just online. They were quarantining. They said a lot about the suicide hotline, actually, and the overall pragmatism of it. And while I do believe that is a great way of going around things, he brought up some flaws. He said she at one point had to wait up to like 30 minutes to get an answer.
Wow.
And she related this experience to me, and I don't want to completely distort it. It comes along the way of her calling and eventually them picking up and hanging up on her calling again, and just having this woman act as though they don't pay attention. I mean, this kind of seems to be her main problem, is the lack of empathy and compassion when it comes to these people. And I am no doubt certain that these people care, otherwise they wouldn't be working at that area. And you also have to base the information on what the suicide hotline does, because they're also dealing with people who are just going through mental breakdowns or, having a really bad day, who are not going to, who are not a safety risk, I should say, at that point. So it got me thinking about the possibility of a hotline of some sort, or some online or some outreach program. But otherwise, I have just been interviewing a lot of people. I've interviewed, I interviewed a male by the name, whatever, not going to say, 23. His current residence was, Carpentersville. We related a lot, and mind you, this was social distance circumstances, but it does seem like there are a lot more people that I suppose deeply suffer with these mental health afflictions than I would have ever cared to know beforehand, in a sense, especially among this time and the uncertainty. There's okay, I'm freezing up here. Never mind. Please just skip me.
Okay, that's fine, Alec. No, thanks for that. Appreciate it. Any questions for Alec?
I think that the 18 to 25 or 26-year-olds are very underserved, and they often don't have insurance, or and they often don't have resources such as transportation or medication. And so they're a group that fly under the radar. What the 708 grant did in Bloomingdale, it allowed my practice to expand services to up to the age of 26. So I now service youth and family between the ages of 4 and 26. And I suspect we're going to increase that more. Probably about 33%, if not higher, are over the age of 18 and looking for services and don't have the mobility to get to the county. So being able to walk to services in the township was a big deal for a lot of the 18 to 26-year-olds.
Yeah, for them, it seems like it always comes down to three things: money, effort, and time.
Yes.
Yeah. Then there's this dilemma that I seem to keep hearing, which is action versus awareness on our part. So I don't see why those two have to be mutually exclusive, but whenever I do interviews, that is something that keeps being brought up. Action versus awareness. Should we, do people want, to spread awareness? Never mind. But you know what I mean.
Yes. Getting the information out there and letting people know about the services is often word of mouth. It's they don't pay attention to, for instance, the township website. That's not in their search. So a lot of clients are word of mouth. Oh, he went there. Maybe I should go there.
Yeah, Don, in Bloomingdale Township, do they have the capacity or capability, I guess, to transport people from wherever they happen to live to where the services are?
No. However, we do have a medical transport system. So if there is a set appointment, there's a medical transport company that will transport for, I believe, $1 to $3 to take you to things. Yes, Trish?
Oh, no, keep talking. I'm next.
Okay.
I got an answer.
So transportation is very tough. A lot of times it's friends bringing friends.
Okay.
So, Paul, the answer is yes. So, the township is a sponsor of the Ride and Cane program. Now, in theory, it doesn't mean you can ride and cane, but that's just the name of the program. So
good marketing.
It's great marketing. But we, as the 708 board, could allot money to this, and it's door-to-door service. And Cindy, if you want to jump in at any time, I don't want to throw you under the bus, but it's door-to-door service, and that is something that we can give the township money to expand the services 4 people approved by the 708 board to use it for counseling programs, drug assistance, etc.
AA meetings, NAMI,
Right.
even the recreation programs that are drop-in centers.
Right. And we could also, because there are townships that actually partner with cab services,
Yes.
Mm-hmm.
where they buy
Time. Yes.
tickets times, I don't know what, yeah, I get it. And the 708 board, you know, it can only be used for 708 approved services. It's not like you can use it to go to O'Hare or go to Chicago. But, you know, and then, you know, so there, we do have options besides medical transport. The medical transport could be handled by Ride and Cane, you know, but we do have options.
Okay, thanks for that, Trish.
Can I just add one thing? Because
Sure.
Dawn kind of like reminded me of something that was mentioning one of my notes, that sometimes in our schools that we have school community partners, and we send or recommend students with their families to go to outside counseling, and they get there and they don't have insurance, and they end up paying like $100, $200. And also they might have insurance, but that specific community partner might not be covered in their insurance. So if this is an issue for families and adults, imagine for youth that don't have insurance.
Correct.
So I just feel like it's important to keep that in mind, that, you know, that age, 18 to 24, youth are also trying to figure out who they are, where to go, college, work, you know, trying to be independent. So that just kind of puts a lot of obstacles too into like the insurance world, and do they have the money to pay for the sessions, etc. So I think that it's very important too.
We able to subsidize insurance?
Yes.
Okay, because that was something I was wondering previously, as an idea to entertain.
And technically, and Dawn, jump in here. Technically, it's not subsidizing. We will subcontract, because the township does not. Bloomingdale Township has people like Dawn, caseworkers, therapists like Dawn in their facility. We could do the same thing, but we decide whether or not to put them as township employees or subcontractors.
I've seen both. Hanover Township has a large mental health unit.
Yeah.
And Wayne Winfield has a very small contract unit.
Right.
Both Hanover Township and Bloomingdale Township have free counseling services. And because of that, I've had a waiting list for 35 years. Every year that I've been there, there's always been a waiting list.
Right.
The requests exceed our ability to fill that. We do triage, but that means some people often wait anywhere from 2 to 6 months for services. What's helped is the police social workers that have come on board in the past 2 years through the 708 board. Every domestic violence event, every police event with juvenile delinquency sees a social worker that day. And then services are offered, and many of them are sent my way.
Just to define something, you said police social worker?
Correct.
Okay, so a police officer who is simultaneously
No.
No.
I am sorry.
It's an MSW who is employed by the particular police department. And they will often go out with police officers, or they'll be called in by the police officers, and they will go and talk to the family. And some of it is right away during the event, and some of it is the next day, depending on the timing.
Okay. That makes a lot more sense. But thank you for clarifying. But yeah, that's great.
It is great. It makes a world of difference with our drug-involved population. Also, we have a contract for 10 treatment beds with a group that we've contracted with. So there are in-house and outpatient treatment services available in Bloomingdale Township.
Now,
And I'm just going to make one comment here so that there is full transparency. As we talk about other locations, whether it's McHenry, Bloomingdale, all services must reside in the township. So we
Right.
cannot send anybody to Elgin or anybody. The services must exist in the township because it is township money.
So every one of my patients and clients must have a Bloomingdale Township residence.
Correct.
Now, if they're homeless, we go by their previous address or most recent address. But they must reside within the boundaries of Bloomingdale Township. And that's the same thing for Dundee Township. It's taxpayer money, and it must be used for the taxpayers in our catchment area.
Right. And of course, every township is a 6x6 square mile. The uniqueness of Dundee Township is we have 9 villages. So 70,000 to 75,000 people across 9 different villages. 4 in totality. For those of you who don't know, it's Carpentersville, East Dundee, West Dundee, Sleepy Hollow. Then we have the Kane County side of Algonquin, portions of Elgin, Gilbert's, Hoffman Estates, Barrington Hills. So as you can see, you know, it's a, you know, that is one of the things that makes Dundee Township a little bit different than most townships, which are inclusive of a portion of a city or a portion, you know, 1 or 2 villages. We've got 9 different demographics. So keep that in mind also.
Okay, thanks for that, Trish. So what I'd like to do now is to move on to Cindy.
I was not able to watch the part of the meeting that I missed last time, but I did connect with Dawn, and she basically filled me in on my job or what the interviews I would like to do. I have not done any, but I can tell you, I know a concern for many of us, which would be mine. My daughter Dallas is 34, higher functioning. She works part-time at Jewel. She volunteers at Cherished Places. She's fortunate to have a huge network of friends. I know Trish from Dallas uses riding cane because she does not drive, but she has friends that drive. We used to participate quite a bit in NISRA. But for some time now, living arrangements is a big concern. I don't want her to live alone. She's too social. I have been interested in a couple of places that have been in Elgin that are 20 handicapped people. with the rest being low income, or 20 handicapped people, with the rest being seniors. We've talked about, I want Dallas to have a roommate that's age appropriate. Don't want her to live with a 65-year-old lady. It would be like living with me. So, and it's very, very scary. It's very scary for the parents to let their kids go. Dallas has lived out with her sister for about 15 months, and then her sister got married, so she had to come home. So we do have a possible roommate right now, but the problem is the waiting list to go somewhere where, you know, the parents feel safe. But I'll tell you, most of the parents, at least of the female friends, do not want to let their child move out of the house. And, you know, I understand it's scary, but I do anticipate dying someday. And I do think Dallas is capable of living on her own with some help. So now that I know that there's even 9 villages I can reach out to, I will touch base with everybody and see if there are newer and different concerns. Some of them will also be keeping a job. When the economy's good, people will hire a handicapped person, but when the economy is bad, they're kind of low priority. Dallas has had the same job forever, and she has great benefits and stuff, so it's very hard for us to, you know, have her try something besides being a bagger at Jewel. But I don't know. I will do some homework.
Okay, great. Thanks, Cindy. Any comments or questions for Cindy?
I just want to say I wish your daughter the very best, and I'm sure she's a sweetheart and, you know, a good person. That's all. So
She's very social.
She is.
She is.
Yeah.
also, you know, I understand your concern. I've heard a lot of stories, so yeah, I really hope you work that out, because I'm close friends with a woman who's kind of in a similar boat, and I know that it can be very troublesome. So
I do want to make a comment, especially young people with special disabilities, whether it's mental or physical. Parents have, or they go to school until the age of 22. When they turn 22, the quote unquote bus stops coming. So D300 has a great program that works with the van, right? The great, yeah, the life program that works with the people who are a little bit high, are able to live out on their own, have a job, but because once again, I'm in an opportune or a special place, I do get to talk to a lot of families. And you know, their concern is what happens if I die? I can't let my child go live with their siblings because their siblings have lives. So Cindy, I want you to keep us on task on that as much as possible, please.
Can I also ask another question? Would your does your daughter experience any like other like things such as chronic pain, or is it purely high function?
No, she's physically, she's, you know, fit as a horse, and you know, she reads at like a 2nd to 3rd grade level. She actually does take, before the lockdown, she was practicing with a teacher once a week on reading because of technology. She knows how to use her phone and she knows how to cheat, but I don't want her to quit reading and then not know how to read one day. So I'm kind of been making her practice reading. But no, she doesn't have any physical
because I know those tend to go hand in hand sometimes, and you know, that's another aspect I think worth bringing up when it comes to, I guess,
She's had plenty of friends though that also have physical issues.
so I'm sure, you know, that's something we should probably, you know, focus on. I don't know. I don't want to be politically correct or offend you and say the word disabled or handicapped or anything. I just, you know, because in the end, she's your daughter. So, you know.
Okay, thanks, Alec.
Sorry.
No need to apologize. Okay, thanks, Cindy, for that. And we look forward to some of your future discovery as well. Okay, I'll take this opportunity to summarize my experience. So I volunteered to reach out to police chiefs, fire chiefs, village presidents, etc. I have talked to 5 police chiefs since we last met. And a couple of themes came out that were pretty consistent. It's probably no surprise to anybody that the police are often who gets called when there's a problem, regardless of what the problem is. Mental illness, substance abuse, opioid overdoses, homelessness, domestic violence. These were all things that most of the police chiefs highlighted where they get called in. Some of the chiefs were wanted me to know that their officers have been trained in de-escalation techniques and all those types of things, but they can only do so much. And oftentimes, particularly with homeless or people with drug addiction or alcoholism, they'll take them to the hospital. Generally to Sherman on Randall Road here, and Sherman will do what they can, oftentimes, and they release them back into the community. And so a constant theme with the chiefs I talked to when they were Chief Joswick and Gilbert's, Chief Rivas here in Sleepy Hollow, where I live, Chief Kilborn and the social worker assigned to the police department there, Meg Crace. And let's see, who else do I got here? Chief Carpenter in East Dundee and Chief Gorski in West Dundee. And they brought up all these points. And I would say that the one thing that bothered them the most was there's no follow-up or continuity of care. The chiefs would relate individual cases. They wouldn't tell me who the people were, obviously, but their recent experiences where, one chief related that 3 times they took somebody to the hospital in the same day and they were released. And then they got picked up again and they were brought back to the hospital and then they were released again. So continuity of care follow-up in particular is something that they would love to see. They would welcome it. All of them clearly would welcome that, because at the end of the day, it's going to make their jobs easier if these people get the assistance or the help that they require. They brought up the homelessness. They talk about, primarily most of them talked about, these the homeless people are known to us. There's these gentlemen that wander between East Dundee and Carpentersville, for example. We know who they are. One of them's a real racist and won't go to pads. Some of them won't go to pads for any number of other reasons. But Chief Kilborn, told me that he divided the homeless population up into 3 different categories. And we've already talked about these. There are the 3 or 4 people that they know consistently in Carpentersville. They're in the parks or whatever the case is. there are people who are in other people's homes, the sofa surfing, the bed surfing that we talked about earlier, or living in the basement. And then there's another subgroup that lives in hotels, moves from hotel to hotel or room to room. They may find themselves on the street periodically, or in other people's homes, but they live short-term in hotels. And his point in particular was, he said, you know, some people will accept help, others won't. But his real concern about people in the last two, the people who sofa surf and the people who live short-term in hotels, he said, they're easily victimized in a lot of different ways. And because they feel uncomfortable about what their current arrangements are, they generally don't seek help, or they don't call the police if they've been victimized, whether it's violence or they've been robbed or whatever the case is. And that's, from a police perspective, that's a concern, a real concern. And so if there was some help, you know, whether it's a homeless shelter or other ways to help these people, that would be truly welcome. Transportation was another issue. We talked about that already. I'm not going to go into any great detail on that. But the continuity of care, a caseworkers to follow up with people, make sure they get to their appointments, or arrange for them to have appointments, arrange for them to get their medication or control their medication if they're on medication. You know, some medications have to be administered rather than taken orally. You know, make sure that they take their medications or go for their appointments to receive their medication. This was a constant theme among the 5 chiefs that I talked to. You know, and while, you know, and a couple other suggestions, well, another theme that ran through was most of these people who have mental disabilities or are homeless, all of them said very clearly that they don't belong in the, you know, in the criminal system, in the criminal court system. And that, you know, but they need help. There's got to be another avenue to get them help, because throwing them in jail, and I actually had some police officers say, we just won't take, you know, if this type of situation occurs, we're not going to take them to jail because that's just going to make it worse. But they don't know where to turn. And so all of them said to me, you know, if you can figure this out, the collective you, that would be great. Chief Carpenter in East Dundee suggested that we might want to talk to the Kane County Chief Judge. That's all he said. He didn't say that the Chief Judge had good ideas or anything, but it's probably something we should keep in mind. He also suggested we talk with Sheriff Hain, which is on my list who's on my list to reach out to as well. But he said it was really important all of these people said it's really important to keep these people who really need help out of the criminal justice system, because they're not committing crimes. They're bothering people, or they're acting in a way that makes people uncomfortable in public. So we need to help them. Also, there was also mentioned was help with legal issues. So an example was, and I don't know whether this would fall in our purview or not, the example was getting an order of protection, for example, in a domestic violence situation. Oftentimes these people don't know where to turn to, or how to start, or even how to go about getting an order of protection. And to have somebody help them go through the steps to do that would be helpful. I think those are the major themes. I guess the best quote I have here is that, you know, police can do point-in-time intervention, but are able to solve these types of problems, which I think pretty much succinctly summarizes what the police chiefs were telling me. So I'll upload my more specific notes to the SharePoint so you can all see them. And I will continue to reach out. And my next, I'm going to avoid talking to police chiefs and fire chiefs in those communities, particularly Elgin and Algonquin, which are large. have larger populations and smaller piece of them are in Dundee Township at the moment. And I'm trying to focus more on the communities that are more almost wholly contained within Dundee Township at this point. So my next step is to reach out to the fire chiefs and have a discussion with them. So that's next. Any comments, questions?
I would have Oh,
Go ahead. Alec.
oh, I'm sorry. But anyway, wow. Lot to take in. What would your opinion, Paul, be on, I know this is getting way ahead of ourselves, but at the same time, I don't see this problem ending anytime soon personally. What would your opinion be on some form of a temporary shelter of sorts? I mean, I'm not sure we're within the means, but I mean, something
Well,
does have to be done.
I think, Alec, that having that option on the table is something that, to discuss further on down the road is certainly something that I think is, we should probably talk about.
Because there does have to be a solution somehow, or, I mean, these people are suffering. How can we mitigate it? How would you personally see the best way of mitigating this?
Well, I don't know that I have an opinion on what the best way to mitigate it is at the moment. I think it's something that as a group we can figure out, where it sits in a priority list of things that we need to do. I mean, there's going to be a lot of things that we want to do, but we're not going to be able to do them all at once, and we're going to have to decide how to do them. I would also mention, when I talked to the police chiefs, I presented through the discussion at the end, I told all of them that this was a process for us and that it wasn't just they were going to hear from me or someone else just once. That as we refine our actions going forward, that, we will certainly be in communication with them. Oh, the other thing I just want to bring up too that I forgot to mention was several of them said, it would be really nice that once you have services lined up or whatever it is that we end up deciding to do, that we provide the police departments with contact sheets so that if they know they have this type of situation, they can call this number or they can send an email or they can reach out to somebody. If we decide we need caseworkers in the township, maybe that, that would be a point as a a point person or point people as a possibility. So having like a 360-degree communication with not only the police, but everybody else that we're talking to, I think is an important thing to remember going forward as well.
When I used to work at the middle school, we used to call it the family resource package, and it was like a physical brochure that was divided like clothing, food, homeless, drug and addiction, and it would just list the resources, contact information, and a brief description of what they did. The problem is that most of the time it was outdated information. So if we do end up preparing something, because non-for-profits are so like 1 year they can be like, funded, or 2 years, and then all of a sudden they disappear. But if we end up preparing or getting a resource packet, it would be nice if we are able to, confirm that they are, a legit organization or like a good resource that we can share with the community and stuff.
Yeah, no, that's a really good point, Maria. Thanks. Yeah, you got to keep it up to date. I used to run technology organizations during part of my career, and keeping that stuff up to date was tough. Just to let people know how to use a computer.
Well,
this is much more important. Okay, Wendy, would you like to tell us about what you've uncovered?
it's kind of good that I'm last because I can recap, because I heard from clergy and lay staff and members a lot of what you all have already lifted up, especially the growing visibility of our homeless population and concern over that. What I think was unique in talking with clergy and lay staff, particularly youth ministers, is a real concern over the relatively high level of depression that's being manifested by people that comes out of isolation and loneliness, and just that lack of social network and connection is something that they're really concerned about. Also, and this goes with homelessness, but it's beyond homelessness, which is growing food insecurity in our area. And with that comes a great deal of shame. Actually, people don't want to ask for help. They don't want to admit that they don't have food and need food. Let me just give you an anecdotal example of that. The church that I'm pastor at is part of a multi-site ministry with Trinity in Carpentersville and Barrington United Methodist Church, and we do a community meal once a month that's free and it's open to everybody. We normally serve around 70. We are going to have 158 meals given. This time we can't do it in person. We're doing a drive-through. And we've got requests for 158 meals. And we were talking about that. And one, there's a greater need for meal support right now, food support right now. But there's also more anonymity in just driving through and picking up a meal. And the level of shame that people have. I've heard people say, you know, I used to work at food pantries, now I have to go to them. And just as we talk about mental health, just to be aware that right now there's a great deal of depression and stress and anxiety, and that plays out in increased use of alcohol and drugs and domestic abuse. So everything we've talked about is heightened right now, I think, in this pandemic. That's what I'm.
Oh,
That's it.
I would go as far as to say, like, even paranoia as well. It's quite
I
tragic.
agree with Alec and Wendy. The pandemic is like a giant magnifying glass and really exacerbates any vulnerability.
Yeah.
And so anything that was going on pre-COVID-19 has become extremely more emphasized. So more depression, more anxiety, more domestic abuse, more predation, and more isolation.
Yep. Yep.
So it's kind of exaggerated everything.
Exactly. And that's what I heard, Dawn, from everybody I talked to, was just the isolation, the loneliness, the depression.
Oh yeah, Zoom.
You know, now kids are going to be learning remotely. Most churches still are not doing in-person services, and so points of social connection are not there. So.
Yeah, and
Excuse me.
I know the D300 food pantry is, you know, when it's open, not to say that, you know, when it's open, it's dates, I don't know what they are. That's drive, you know, curbside, the same with Fish, Dundee Township, Cares Food Pantry. We are the only food pantry that delivers to our seniors. And to help with the isolation, they get a crazy letter from me every week, along with a pack, about 10 different puzzles, coloring sheets. Early on, we gave them coloring pencils. And so, you know, isolation, I mean, you know, Wendy, you hit it on the head. We are, with these kids going to school, they're doing e-learning, they're isolated. I'm hearing from parents, and you guys are going to get sick of hearing what I hear from parents and stuff. But I've got parents who have to go to work, and they've got kindergarteners, second graders, third graders, and they're like, we really hope they can do Zoom by themselves, and because they have nowhere to put them. They can't go to a one celery. They can't, do this. And I think what's going to happen is we're going to see parents who are going to have to stay home with their children or have to work first shift, second shift, third shift, and that food insecurity is going to go up more and more, and the embarrassment. I have seniors who call and they're like, "Do I have to give you your name?" And I go, "Well, yeah, I know. I need to know where to deliver the food." And they're like, "Oh, okay." I tell them it's kept, secret. It's not, handed out, but they don't want their neighbor to know they're getting a delivery, from the food pantry. I think these are all things we have to take into consideration.
And the other thing, and Alec and Maria, you both lifted this up too, but with young people, I'm hearing, Trish, from parents that kids are locking themselves in their bedrooms and not really locking themselves, but they're staying in their bedrooms. They're not coming out. Some of the parents are very worried about suicidal ideation with their kids, because you just look at what's also going on in the world around them right now, and our young people are pretty overwhelmed emotionally.
I think faith is a good answer. I mean, I am not a Christian, and at best a semi-practicing Jew, but I have to say that, faith can be very powerful in bringing upon that hope and that optimism. And we need to find a way, as much as I'd say that organized religion has its own, slight problems, but I do think in this instance, wow, I think this is I think faith is very important and is an amazing tool to bring us together. It needs to be utilized. No matter what you believe in, who you are, just, I don't know. Sorry.
Okay, thanks, Alec. Wendy, is there anything else?
Nope, that's pretty much it, because you all hit on the major themes I heard too. So.
Well, I think it's encouraging that there's some common themes running through all our conversations with people in the community. So I think that's very positive about what we've uncovered over the last month or so. And so I would encourage everybody to continue to reach out and see what else we might be able to uncover over the next month or so, and bring that back. I would encourage everybody to, who have written up their notes, to put them on SharePoint so that we can go back through them again. I will volunteer to sort of summarize some of the themes, the high-level themes that we've talked about tonight, to start to put together maybe a framework of how we want to start to tackle what types of, specifically what types of services we might want to provide the community. Just as a framework, I'm not trying to impose my views on anybody, but just sort of get a summary, and I'm sure there'll be gaps in it and I'll miss things, and then we can sort of grow that document a little bit to help us frame conversations moving forward. Also to help identify speakers that we might want to come if we're going to focus on maybe homelessness for one discussion, or mental disabilities or, food security or, whatever it is, we can, try to line up speakers to, maybe provide us with some more insights along those lines, if that's okay with everybody else. So I'll take a first stab at that framework, just as, or themes that that we covered through tonight, sort of as a, because we want to be able to capture those and not keep returning to what are the themes again, but try to keep moving our discussions forward. So I'll do that prior to the next meeting. Probably try to get it done in the next 2 weeks if I can. So if there's no other comments or questions, I will entertain a motion for adjournment tonight.
First,
Very comment. Sorry. I am still waiting from 3 other people. I don't know if you guys know, but through SharePoint, you can actually go back to your original document and add on.
Yes.
So, I mean, I just wanted to let you know because I thought that was pretty cool. And also that, I don't know if this is the appropriate time or not, but I was invited to their Elgin 708 mental health. Not to participate, but I recently got a job offer with the school district in Elgin. And I believe it's Karina Villa. She is one of the people in charge there, and she invited me. Are we allowed to kind of? Okay.
say hello to Franklin for us.
Okay. I will.
No, that'd be great, Marie. I think seeing what other people are doing directly is, I think, a good thing. And we're lucky to have Dawn, who can tell us what's going on in Dundee Township, right? So
yeah, and Elgin Township is in the same boat as we are. They're just starting.
New.
They're brand new, so
Awesome.
come back with what they're struggling with, so we don't have to.
Okay, I think I have a first and a second.
You had a first. I was first.
Yeah, I thought I heard Maria second.
I'll second.
Oh,
Okay.
Alec.
We have a second from Alec. Any other discussion?
I do want to say that the theme has been, from what I've noticed, very intersectional. And I think a lot of you did a really good job pointing that out. And it was nice talking to you all. So that's about it.
Okay, thanks, Alec. Maria, can you take a roll call for the motion on adjournment?
Okay, so this is the motion to adjourn the meeting. Trustee Dawn Arimura,
Yes.
Trustee Maria Borrero, yes. Supervisor Trish Glees,
Yes.
Trustee Alec Neuschaefer,
Yes.
Trustee Cindy Oldin,
Yes.
Trustee Paul Setze,
Yes.
Trustee Wendy Witt.
Yes.
Great, so 7 yes, 0 no's.
Okay, thank you, Maria. Okay, the meeting is adjourned.
Okay, with that, I am going to end the recording, and I am going to immediately dismiss all you so that there's no crosstalk. Thank you very much.
Thank you, everybody.
Thank you.